Good evening and welcome in to the news at 6 here on WRTV. I'm Mark Mullins.
And I'm Amanda Starrentino. First tonight, a story advocates were fearful would happen. There's been a spike in domestic violence cases as the pandemic has kept people in unsafe homes. WRTV's Stephanie Wade speaks with a forensic nurse at Methodist Hospital about what they are seeing and resources available for people right now.
A startling statistic tonight. The Indiana Coalition Against Domestic Violence has reported the number of deaths related to domestic violence in our state has increased by 86% compared to this time last year, a rate forensic nurse Julie Morrison can attest to.
For me, just actually in the hospital, I still worry about the increase in violence. I mean, it's just kind of a pressure cooker right now. It really is.
A forensic nurse at IU Health Methodist Hospital, Morrison, like other advocates, were worried how the pandemic would impact ongoing domestic violence.
At the end of March with the stay at home, we knew something bad is going to happen because for people in abusive situations, at least they had that reprieve maybe when the abuser went to work.
As job loss, health concerns over the virus, kids at home and not in school, all colliding.
Kind of all the factors that worsen domestic violence or intimate partner violence, just exacerbated by this pandemic, those same kind of things, financial insecurity, losing jobs, and we knew this is going to be potentially bad with people being stuck at home together.
Whereas people were not coming to the hospital in the beginning of the pandemic.
At the end of March is when the stay-at-home order started. We saw 46 assault patients. Looking back at 2019, we saw 71.
She says they are now coming in droves. Methodist seeing a significant spike in cases from last year and a large increase just since March alone.
For me and for Silent No More, it has been a drastic increase in calls and in services that are needed.
Nonprofits like Silent No More and emergency shelters are working double time to find people safe housing, but with limited resources, as shelters operate at limited capacity because of COVID.
It's been extremely tough, and as a survivor, I just don't I don't know how I would have been able to do it if I didn't have an organization who was open. 9 times out of 10, I probably would have stayed just because, the resources are so scarce.
As the need only increases and situations become more dire.
To those victims, try to keep them encouraged as much as possible. Know that there are survivors out here that are willing to walk with you and walk through that experience with you, so that way you're not alone.
Stephanie Wade, WRTV.